Okay, we're trying this again. Yorktown, it's Supervisor Matt Slater with our 46th video update. I'm joined once again by Stacey Petrower, President of the New-York-Presbyterian Hudson Valley Hospital Center, as well as Dr. Bill Higgins, who's the Vice President, Regional Executive Medical Director for New-York-Presbyterian Medical Group. We had some technical difficulties moments ago, but we were just going over the numbers, which I'll provide again. 22 active cases in the town of Yorktown for today. On Tuesday, when we reported back to the town, that number was at 27. So we've seen a decrease of 5 in the active caseload. Since we started testing in March, we've now had 696 total cases in the town of Yorktown. And right now we have 2 new cases since yesterday. Overall for Westchester, we have 553 active cases. We've had 27,558 total cases, and since yesterday, we've had 41 new cases. So Yorktown, 2 of the 41 new cases for the county. Regionally, and these are the metrics that were provided by New York State, which is so helpful for both us in government and, of course, our healthcare professionals as well. Regionally, for the Mid-Hudson region, yesterday there were 8,735 tested, and only 99 tested positive, which is a positive test rate of 1.1%, which is really just spectacular. Phase 3 is upon us. We've talked about Phase 3 quite a bit leading up to Tuesday. It did begin on Tuesday. And as a reminder, folks are able to go to their favorite restaurants and eateries here in Yorktown now with a 50% capacity for indoor dining. This includes, like I said, restaurants and bars. Tables are limited to 10 people, and staff at these restaurants have to wear masks as a reminder. Again, spas, nail salons, tattoo and piercing facilities, massage therapy, tanning salons, and waxing services have all come back online as part of Phase 3. The JV Mall, we've gotten a number of questions about this, and the governor announced yesterday that malls, our fitness centers, and movie theaters remain closed. That does apply to the JV Mall and our local fitness centers. We did open Sparkle Lake Beach last week, so that is open, and the rules can be found on our Facebook page. So we ask you all to just, again, adhere to those rules. And tonight we have our first ever mobile movie night over at the JV Mall playing Toy Story 4. Please remember, only if you registered can you attend. And that is tonight. We're very excited about that. Our next mobile movie night will be on July 9th, playing Frozen 2, and we'll be announcing the details of that shortly. And tomorrow, which is Friday, June 26th, we're going to be providing free masks here at Town Hall again, in partnership with our friends at Higgins and Westchester County. We have those white reusable cloth masks, and so we are able to provide another free mask distribution tomorrow, starting at noon here at Town Hall. Starting at 1 o'clock here at Town Hall. And lastly, I spoke with our Parks and Rec director a few minutes ago. He's busy getting ready for tonight's mobile movie night. But good news for everyone in Yorktown, thanks to the hard work of our Parks and Rec department and our Parks and Rec commission. All of our parks and playgrounds will be open by Saturday here in the town of Yorktown. And that's something that we've heard from a lot of families and residents asking when their local playgrounds were going to be open. And we're proud to say that as part of Phase 3, we've been working diligently to make sure that they are safe, and they will all be open by Saturday. And with that being said, I want to bring in our 2 very special guests. Again, Stacey Petrower, who is the president of New-York-Presbyterian Hudson Valley Hospital Center, and Dr. Bill Higgins. Again, thank you both for being here with us tonight. Really do appreciate your time. Dr. Higgins, would you want to give us an update relating to COVID-19 and what you're seeing on the horizon and how healthcare has been impacted by the pandemic?
Yeah, sure. Thanks again, Matt, for having us on tonight. One point we brought up earlier when you're mentioning the COVID cases that Yorktown is experiencing, I think it's important to differentiate that from people who are ill with COVID or perhaps are hospitalized with the coronavirus. So these could simply be people who tested positive on a serology test. And I'm very encouraged by these numbers in New York State and in our region. And I think it has everything to do with our leadership that you've been providing on such a frequent basis. I've watched you on Facebook. You're doing a tremendous job communicating. And if there's lessons learned from this pandemic, now that we're in the fourth month, it's the communication that New York State has given all of us. And Stacey and I have certainly seen it in the New York-Presbyterian health system as well. Our CEO, Steve Corwin, a cardiologist, and Laura Faris, our COO, an orthopedic pediatric surgeon, have for the last 4 months kept the entire enterprise informed in the beginning on a daily basis. And then recently, now that we're down at 1%, a little less frequently. And Stacey has done the same here locally at Hudson Valley and the medical group. So communication is key, and that message of where we're at in time and statistics and understanding statistics and seeing that we were, well over 10% positivity right now, down to 1% is very encouraging. We're at a state right now where we're looking forward to welcoming our patients back, and we have for the last 2 weeks in the enterprise. We call that Renew, and we are looking forward to welcoming our patients back. And Stacey and I will get into that a little later, where as we continue this conversation, the measures we put in place over the last 4 months in preparation for right now, where we are continuing social distancing and disinfection of high-touch surfaces, and obviously wearing masks, that has made such a tremendous difference. And I think as your constituents in Yorktown and on Facebook will see, we can't let our guard down now. It's right. So important. We see it in Oklahoma, Texas, New Mexico, Arizona, California, Florida, the Carolinas. We really need to keep this up, and I'm delighted we're in phase 3. I can't wait to go into Yorktown and enjoy some of the really great restaurants we have there. But at the same time, you'll never see me walking around town without a mask. So that's important. I'm going to just do one little show and tell thing, if you don't mind, and then I'm going to do it. One of the things I often see people walking around with their masks is there's a right way to do it and sort of a wrong way to do it. The right way to do it is to cover your nose and your mouth. And one of the reasons we do PCR testing to test for the coronavirus is we put a Q-tip in people's nose, and that's where we get the virus. So oftentimes you'll see people walking around like this. You might as well not wear a mask if you're going to be walking around like this, right? Because the virus is right in here, and sorry for sore my nostrils, but this is the right way to wear a mask, whether it's a cloth or a surgical mask.
That's a great point. And we get those questions a lot. What would you say to folks, because you did just say that you wouldn't be seen walking around without a mask. What would you tell folks in the community? Obviously, we continue to say, if you can't maintain social distancing, you have to wear a mask. How long do you expect that to continue for? And do you see that, is that something that we're going to be seeing, for the, at least, the rest of the year? Is that something that we should be getting used to?
Matt, that's a great question. And unfortunately, the answer is well into 2021. I don't see us changing or deviating from this new normal until after we have immunization and perhaps herd immunity, which is not going to come for quite a while.
Right.
So this becomes a new, accessory with, match your tie, do whatever. But
I've got several that match my shirts and my ties, and I try to sport my Town Strong from our friends at Sports Barn. I want to give them a plug. They gave us a great mask.
Awesome.
But it's an important thing, and obviously for all of our first responders and frontliners, making sure that you had the right equipment was crucial. And we're just in a lucky enough position that we've got an excess amount that was provided by Haynes through our partnership with Westchester, and so we're going to be able to provide those to our residents, and we're going to hopefully be able to continue to provide that service as this continues. As you said just now, and I really hope people understand this, because I was at the bank last night, and I left my family in my car. I got out, I had my mask on, I went to the ATM, I come out, and as I'm coming out, an individual is walking in, no mask. And that was my face. Exactly, Bill, what you the
Right.
face. And I just thought to myself, we said it before, we're not declaring victory on this. We're at 22 active cases. That's great. That's we deserve to applaud ourselves on flattening the curve, but it doesn't mean that this is over by any stretch of the imagination.
Sure. And a little later, I'll get into asymptomatic carriers that can be super spreaders, and that's so important. And that's why it is important to wear a mask. And Stacey and I have spoken about this earlier, but I just don't understand the controversy in terms of wearing a mask. When a surgeon goes into the operating room, he's wearing a mask to protect the patient. It's not the patient protecting him because he's wearing a mask. So wearing a mask is just a simple sign of respect for our fellow citizens, because we could be asymptomatic in carrying the disease. It also does, by the way, help mitigate any droplets that may be in the air for you catching it as well. But the main reason why we wear masks is to protect other people around us.
Absolutely. And I want to bring Stacey in if we can. Stacey Petrower, again, is the president at the New York-Presbyterian Hospital, Hudson Valley Hospital Center. Stacey, from your standpoint, can you provide a perspective from NYP's standpoint of the overall experience through the COVID crisis? And if you can, any preparations that you can share with us for the fall? As great to hear from Dr. Higgins that we're at the point where we're welcoming back patients, and maybe you can give some of our folks here who utilize your hospital, quite frequently, what to expect if they did have to come in.
Absolutely. If it's okay, I'd like to start by thanking Dr. Higgins for the mask promo, because I can't stress enough how important this is. We all work, 12 hours a day and wear masks that entire time in the hospital. And we're doing that for each other and for each other's families and for our patients and the rest of our workforce to protect one another. And that does not change when you step outside the doors. And we really do need to get people, help people understand the difference of protecting yourself versus protecting the people you love and care about. So thank you, Bill. I appreciate that. And by the way, Bill and I were considering doing this in the same room. And we realized that we couldn't distance enough to not wear our masks, and we didn't want to be masked, doing this presentation. So we decided to separate. But that's a very, a thoughtful decision. We're not going to risk that, and we're healthcare providers, so we're not going to model bad behavior ever.
Exactly. That's one of the reasons we still have our town board meetings remotely. For the same exact reasons you just how do we sit here? I'm sitting in the town boardroom, but you're usually elbow to elbow with somebody. How do you do that, and tell people that they should be wearing masks and practicing social distancing and so on and so forth? So I agree. Yeah. I'm
glad you used the term our new normal, because at some point we're going to take the new away and it's just going to be our normal. And this is the way we are going to have to do this until there's a vaccination for this virus. And we have to get used to it and we have to embrace it. That is why New York came, not full circle, but came out of this as well as we did, because we listened to the guidance we were given from healthcare leaders, from our government leaders, and we obeyed those rules, and we are succeeding. And I can tell you that in the peak of April, things were very, very tough mid-April in the peak of this crisis for our community and our hospital. And I need to give a shout out to the amazing professionals at New York-Presbyterian Hudson Valley Hospital. Our caregivers were absolutely heroic. Our physicians, our nurses, our patient care techs, our redeployed staff from the New York-Presbyterian Medical Group who volunteered to come and work within the walls of the hospital because the medical offices were reducing, the things that they were doing in person. Our environmental services workers who never shied away from going into a patient room to clean. Our phlebotomists. I can go on and on. If I didn't name somebody, I'm sorry, but I would be here, for the rest of the evening. I could not be more proud of this hospital, the way people have showed up to take care of patients and for one another, really. So at the peak of the crisis, we were chock full. Every bed we had was filled. And not only that, but we tripled our critical care capacity. Actually, that's not true. We more than tripled our critical care capacity. We surged by about 60% of critical care beds. So how did we do that? We got very creative. When we stopped elective surgeries, and I want to make the point that NewYork-Presbyterian Hospital made the decision to stop elective surgeries across all 10 of its hospitals, even before we were mandated to do so, because we recognized where we were heading and that was the right thing to do. So when that happened, we were able to repurpose some of our ambulatory surgery area and turn that into critical care. We also took one of our units and made all the beds there critical care capable. We also used our fast track area in our emergency department to separate COVID positive patients from potentially non-COVID positive patients. So there were a tremendous amount of interventions, and we couldn't do that without an unbelievable facilities team who, when we said we need this area to be critical care capable, every single member of that team figured out how we could do this with ventilators that we generally don't use in those areas and other equipment. We used heavy duty, like you would see in a MASH unit, plastic curtains, weighted curtains to separate areas and have negative pressure airflow. It was really an unbelievable effort. And now we know what we're capable of for sure. Not that I ever want to test it again. Yeah. I don't. So I'm going to say it again. Wear your masks.
Yeah.
Just want to tag on to that. Out of the innovation that we saw in the hospital, Matt, one of the things we were struggling with on the outpatient side was the use of technology in reaching out to our patients. And during the pandemic is where we finally realized that we can really innovate at this point. And one of the things we did was we really geared up on our telehealth platform, where we were able to get into people's homes, just like we're doing now, actually, using the same platform. So the medical group, in partnership with the hospital, were able to take care of the discharged patients from the hospital using technology like this. And I have to tell you, it was one of the most moving experiences of my life and many of the physicians' lives, actually getting into very, very ill people's homes through technology and being able to help them and speak with them and look at what their surroundings were like and make changes. And I think it was very comforting to our patients and their families, but it was also a bit of a relief to us that we were discharging people back into the community who were still pretty ill, that we were able actually to go into their homes and see them. It would be impossible to do home visits on all these people. So we were able to do stuff like this. So that was incredible partnership with the NYP IT team, as well as Hudson Valley Hospital.
Do you see that telehealth practice continuing? Is that something that was been really
here to stay, Matt? It's definitely here to stay. And as everyone became used to it, we realized how easy it was. And it also, by the way, to your point before, it helps us with social distancing right now. So as we look at all our schedules in the office, we still have to maintain social distancing. You can't have people in your waiting rooms just sitting there a few years apart. So now we're able to mix telehealth with live patient visits. Our patients love it, and it's good patient care.
And how would you, for the folks at home who are watching, especially our seniors, how would they be able to get introduced to this telehealth option to get some medical care in case it's needed?
Great question. Seniors are actually one of our best customers. They completely surprised all of us. All it really takes is either a laptop or either a smartphone or an Apple phone. And if they didn't have it, they had relatives or kids or neighbors who did have it. So that really wasn't an impediment. And when and if it was, there was also telephone visits, but it never really got to the point where we couldn't contact them and treat them.
That's great. Yeah, I went on a telehealth call at one point. So I had an ear infection in late April, and I wasn't going to go in. I eventually wound up having to go in, but we started with a telehealth visit, and it was actually really cool. It was, to your point, it was very convenient, right in my living room, and I'm just holding my phone, talking to the doc, and explaining what's going on, and getting diagnosed and getting the whole bit. So it was great. I wanted to just go back to the you talked about asymptomatic patients at one point, and that's something that I think we wanted to turn back to, because we keep hearing again we're guarding against a second wave. So Dr. Higgins, can you just go into a little bit on the asymptomatic side and explain to folks at home what that means and how we can just make sure we're protecting ourselves against that?
Sure, absolutely. So one of the more fascinating things that are coming out of this very new COVID-19 disease is the fact that it is new and we're learning as we go along. I've known people here in the United States who've had to reach out to their colleagues in Italy and in China to sort of get just their brief experience treating these very ill patients, because at this point still we don't have long-term randomized trials of studies that we're able to say, all right, this is scientific, it works. We're barely doing peer review at this point, so we're kind of building that plane as we're flying it, but we are accumulating evidence. So in the beginning of this pandemic, the news out of China was really there's no such thing as asymptomatic carriers, and that has not borne out over the last 4 months. And we know up to 30% of people can be either pre-symptomatic or asymptomatic carriers of COVID-19. And to Stacey's point before, that is so important, because you see down in Florida, these young adults on the beach that are not practicing social distancing. They have loved ones at home that they may be going to, who may be either elderly or immunocompromised, that would get very sick.
Right.
So there is a asymptomatic carrier rate out there, and we call these our super spreaders. These are people who go to bars and parties that perhaps don't wear masks, or even go to church without wearing a mask. And even though they're not symptomatic, they are spreading the illness.
Yeah, that was one of my greatest concerns. I mean, my grandmother didn't talk to me for quite some time because I refused to go see her. And I did it just because you didn't know, and I didn't know if I didn't know who I was coming into contact with, and to your point, it really wasn't about me; it was about her, and so she was pretty upset with me for quite some time. But that's what we've been trying to tell people is you have to be respectful not just of yourself, but of your neighbors and of your neighbors' families, because that's who you're putting into harm's way. It's people you may not even know. Just by simple things like not wearing your mask, and even if you are able to observe social distancing, doesn't mean you shouldn't have the mask on. It's just those are the parameters that health experts and our partners in government have kind of dictated as the safe space to be in, right? And so, but I think it's very important for people to hear what you're saying and recognize that this is not going away. Because like what Stacey said, this is normal. This is the normal, not new. It's the normal. And until we have that vaccine or herd immunity, like you said, it's something that we have to continue to guard against. Where do you think we are with the vaccinations? I don't know, Stacey, is that something that you might be able to share with us?
We've been hearing a lot about a quick turnaround on a vaccine. That's just not generally how vaccine creation works. So I'm no expert on this. I'm not an infection preventionist, but what I'm hearing from our organization is that it's just not likely to be anywhere near in this year, or maybe even 2021. It's a ways out there, and we've got to. That's why I said this is no longer the new normal. It's the normal. But I do want to get to what is also normal and incredibly important. People have been staying home, which is the right thing if you're quarantining, but not if you're going to neglect your other health issues, because heart disease, diabetes, pulmonary disease, all of that still exists in folks. It didn't just go away because we have a pandemic. And so it's, as hospital leaders, our job is to make sure that we have a safe environment for our patients to return to. So we have an effort that our organization calls Renew. We call it Renew as opposed to Restart because we never stopped providing care. We never stopped treating our patients, but our patients, often said, okay, this is not an urgent matter, so I'm not going to come to the hospital now. But now some things have become more urgent. And so I just want to reassure our community that we are ready, able, and want to take care of you and have the ability to do so in the safest manner. We've gone through a whole change on how we bring patients into the hospital. Every single person who comes into our hospital is screened for temperature and has to answer a couple of questions for us to get an idea as to whether or not they're sick or maybe symptomatic. If you are sick and symptomatic, you're not going to be able to go for your surgery or your appointment, but what we will do is figure out where we're going to get you taken care of. If you do have a scheduled surgery or a procedure, like a radiology procedure, if you're getting an interventional procedure or surgical procedure, we're actually testing you up to 72 hours prior to your surgery so that we know you are ready for surgery, safe and well, and able to recover. If you test positive, unless it's life-saving surgery, we're not going to proceed with that procedure at that time because we want your immune system not to be fighting two things at the same time.
Right.
If you're coming in and you're well and you're coming for your surgery and you're checking in, we don't allow people sitting in waiting rooms any longer. We've eliminated the bulk of our waiting room furniture so that people are not leaning toward sitting together. And we're asking you to call and we bring you in and you check in and you're going right to where you need to go. You're not sitting and waiting. We're doing a tremendous amount of our registration process in advance, online or by phone. We actually have decals throughout the hospital indicating proper social distancing. So we only allow 4 people at a time in an elevator, each in one corner of the elevator, 6 feet apart. So this is just a sampling of the efforts that we've put in place to ensure that we can safely care for our patients. But, there's also the cleaning. Our CEO, Steve Corwin, refers to it as fastidious cleaning. And we've all ingrained that into our everyday culture. We've hired additional environmental service workers to ensure that we could be constantly cleaning throughout the day, as opposed to what might have been a couple of times a day and at the end of a shift. It's throughout the visits. Everything gets wiped down in between every single patient. We're making sure that our patients are safe.
That's great. And I know here, it's similar things that we were doing here in town government. We just got those, they're not the Clorox 360 machines, but they're the backpacks. They look like Ghostbuster backpacks that go around and they disinfect and deodorize all of the high touch surfaces. And so we're hitting those things 4 times, 5 times a day, in all of our facilities to protect the employees, but also to get us ready. So when we do welcome back, because right now our town facilities remain closed, but when we do welcome back the public, because we want to protect our employees, but we also want to protect the public. So our hats off to you. I know it's a big effort here, and I can only imagine how much larger of an effort it is at a hospital like yours, which is great for our residents to hear that when you do have to go to the hospital, you are going to a safe place, and that it's underhand and being managed properly.
Matt, if I could just say one more thing, I'm going to do a PSA announcement. I feel that people are not, they're not quite comfortable doing their routine stuff that is often life-saving, like your colonoscopies, your endoscopies, your mammograms. Do not put those things off, folks. It's, we're kind of past the peak of the crisis. We know how to keep you safe. And the best thing you can do is take care of yourselves and not let things go. So please get your routine diagnostic testing done.
Stacey, thank you for reminding me and continuing on with this PSA. Is those of you with children out there, Matt, it's so important to keep up with the schedule that your kids are on for their vaccinations and keep them on target no matter how old they are. So infants, babies, kids really need to continue going in to the pediatrician's office and getting their scheduled routine vaccinations. That is so important. And again, the same measures that Stacey highlighted upon our measures that we're also taking in the medical group. So one of my big concerns about this, and Stacey and I talk about this often, are we've put a halt on routine maintenance of people over 50 who need their colonoscopies and or mammography. It is, I think, one message I need to get across to our viewers is it is safe, and I'm certainly going to do mine this year. Too much information, but it's the hospital's been one of the most safest places I could have walked into in the height of a pandemic.
Yeah.
So that thanks for that PSA, Stacey.
No, that's great. And Stacey, I know you've got a couple of other things for the fall that you're planning regarding, I think, your obstetrics center and your cath lab. You want to talk about that at all? Do you want to let folks know what you guys?
Sure. So, the OB center, our Women's and Children's Center, is almost done. We are looking to open it in October of 2020. It's been a wonderful, thing to look forward to. State of the art, brand new. And when we designed our rooms, we were very focused on the family experience. So being able to, when you have a new baby, being able to have your significant other, partner, spouse with you and be able to stay overnight in a very comfortable, welcoming type of environment where we have a kitchenette that we've planned that's going to be stocked with, all kinds of things that you're literally getting up in the middle of the night and walking in your kitchen like you normally would. Things like that, just,
As someone who was there 9 months ago, I can tell you, I wish I had that.
See, there you go. So maybe the next one. And congratulations. But it's really family focused, and we have amazing physicians who've been caring for this community for quite some time, and a new chief of obstetrics, or relatively new. It's a little over a year now, Dr. Mira Garcia, who's one of our Columbia doctors, and she is absolutely determined to make the birthing experience at NewYork-Presbyterian Hudson Valley Hospital the best it could be.
Oh, that's awesome. That's awesome.
I'm sorry, Mike, go ahead.
No, you were going to say.
Okay, great. Mira is terrific, and she's been just a great proponent for women's health at the hospital. And I'm sorry you missed us, Matt, but we are a baby-friendly designated magnet nurse hospital. So maybe for number 3, come on back.
We'll talk to my wife about that. We'll see.
Okay. Kelly, I'll call her. The other thing we're looking forward to this fall is we have a state-of-the-art GI center right on campus. And this fall, we're bringing in a very highly trained interventional GI physician, Dr. Rastogi, and we're very much looking forward to having him join our GI division at the hospital. It's if you're going to have a colonoscopy, it's a great place to go.
You got the GI, you got the cardiac cath lab that you're doing some additional work on, right? And also I think the sleep center, right? You've got a newly opened sleep center.
Sleep center looks like the Ritz-Carlton Hotel. It's brand new, and I've been through a number of sleep centers. It's what I did in a former life, but it is very, very comfortable to come to the sleep center, which is, again, right in the hospital. It's quiet. You can actually sleep there, which has been great.
That's awesome.
It really is. And I'll be remiss if we don't mention our cancer center. Last year, we brought on a wonderful physician who joined us from another organization, Dr. Razak, who leads our cancer center. And this is an area of growth for us. And I want to reiterate that, we had a full panel of patients receiving both radiation therapy and chemotherapy during the course of COVID. We did not stop anybody's procedures. We did not stop anybody's treatments. It was up to the patients. Our physicians worked with our patients to make sure that they were continuing their course of treatment. And that's so important when you are a patient dealing with cancer. You don't want to also have the fear and anxiety of, if I don't do my treatments, what's going to happen to me?
Right.
So also, our cancer center happens to be based in our medical office building. So you don't have to traipse through the entire hospital to access your cancer center. It's literally, you walk through the door into the building and the cancer center is on the ground level.
That's fantastic. And real quickly, I also want to touch upon visitation, because I know there were some policies that were implemented regarding visitation. What is the status of visitation in your hospital right now?
Visitation has resumed as of this past Friday. So we have limited visitation hours currently. It's 11 a.m. to 3 p.m. and it's one person, but you could kind of trade out the person if you want to. So to, tag in, tag out, first mom, then dad, then, grandma, probably not grandma. That was really tough. And I want to say that was as tough on our staff as it has been for the patients, because we know what an unbelievable source of support our family members give to our patients. And our nursing team in particular was really struggling with that, because they wanted to be everything and everyone to each of our patients. And that's not quite possible, but they did a yeoman's job for sure. And we were so happy to welcome our visitors back in to be the advocates for our patients.
That's fantastic. And it's great to see that we're at that point, and with all the other protocols that you're putting in place and all the other safety precautions you're taking, that we have a community hospital right in our backyard that continues to do great work for our community, for our residents. And we really do thank you both for everything that you're doing to keep us all healthy and keep us all safe. It really means a lot.
Thank you. We're also screening our visitors before they come in.
Great. That's also very important. Any other advice you might have for our residents for the summer months that beyond the that's COVID specific? Obviously, again, reemphasizing that you have to continue to take care of yourselves and take those and schedule your procedures and your checkups and. But what about from the COVID standpoint? Are there any other pieces of advice that you can give folks, as we go into the summer months here?
Sure. I think one thing that is important, Matt, since now that we're 4 months into this, is how very important it is to have the one-on-one contact, whether it's 6 feet apart or not, how important that is for our mental health. And I would encourage people to start revisiting. It is summertime. The safest place to visit people is in your own driveway. I think you can drive around Yorktown and you'll see people practicing great social distancing on beach chairs. I think that's a great thing to do. Just being mindful again of not sharing the same plates and whatnot, and keeping that social distancing up. But I think so many of us and our patients have been quite honestly lonely in the last 4 months. And I think now that we can go outside, it's safe to start socializing again in a responsible fashion. So, get out in your driveway and talk to your neighbors.
And I hate to put you on the spot on this one, but what about any thoughts on pools?
Oh, good question. Thank you. So pools are good. Pools are safe. I was on a CDC call this morning, and the virus does not live in pools. But the problem is, if you're approaching the pool and you're seeing that chairs are not socially distanced around the pool, that's a problem. Right. So it's the entire experience. Great. It's great to be outside. Obviously, you're not going to wear your mask in the pool. Right. Don't wear your mask in the pool. Yeah. And coming out of the pool, you still, you need to put your mask back on, and then again, socially distance. So, yeah, bring your kids to the pool and enjoy yourselves.
Okay. That's great. That's great. Again, Stacey Petrower, president of the NewYork-Presbyterian Hudson Valley Hospital Center, and Dr. Bill Higgins, vice president, regional executive, medical director. I can't thank you both enough for sharing all this information with our residents tonight. And just, again, being a great partner for our community, providing a community hospital right in our backyard. And we really do appreciate all you're doing for us. Thank you so much.
Thank you, Matt. Thanks, everybody.
Thanks for what you do. Appreciate it.
Absolutely. All right, Yorktown, stay safe, stay healthy, and we'll see you on Sunday night. Thank you.
Bye-bye.
Bye-bye now.